All right, I'm going to make this easy for you. I'm going to give you the lowdown on a new NAM report that basically talks about what we need to do to make this U.S. health system work. We're going to do it in two parts. Part one, I'm going to explain to you what's in the report, so to summarize it, so if you don't want to read it, you'll at least get a 2-minute summary. And then part two, come back and I'll explain to you what the significance of it is. Just so you can see it, this is what the report is. It's online. I'll put the link below, and here we go. So first, what's the report about? The report is simply, how do we fix this? How do we fix this crazy, inefficient, ineffective healthcare system that we pay a whole lot of money for, over $15,000 per person in the United States per year? A group of really smart people got together and they broke it down basically into 3 areas of system misalignment and then 12 actionable levers to fix this. The first area of system misalignment that needs to be fixed is health financing, which is how we pay for stuff. Within this, they identified 5 levers to fix it. Since I can't memorize these, I'm going to be reading a little bit off of it, so my eyes will shift off to the side. So lever number 1, simple. Align all payer payment incentives and prospective global payment approaches across public and private payers. In short, what this means is they're just saying we need to make it so that providers and health systems don't have to play 20 different games across 20 different payers. All of them should have the same sorts of incentives and payment strategies, whether you're working for Blue Cross or seeing a patient with Blue Cross or Optum. Second lever, encourage insurance and risk pooling approaches that support multi-year investments in individuals and community health. So what this means is basically part of the problem is we insure people for like 1 year at a time, but health outcomes are about longer periods of time. So we need to encourage multi-year type insurance strategies. Third lever, we should be paying for things and have flexible payment for things that just make sense, even if they don't fit like a medical paradigm. So for example, it's sort of the idea of like, if someone has asthma and what they really need is an air conditioner, let's pay for the air conditioner. There's not a way to pay for that typically. Fourth lever, establish mandated all-payer global or total cost of care mechanisms and targets that emphasize effectiveness and efficiency in care patterns and outcomes rather than service volume. This is a simple one. This is basically transition away from fee-for-service for most things to value. In other words, you get paid for the outcomes, not just for seeing someone X number of times. Fifth lever, accelerate preventative care. So do testing, incentivize models that focus on early intervention and community-based approaches, not just treat people when they're sick, keep people healthy longer and figure out those models to do that, not just on the individual level, but also on the community level. That takes us to our second system misalignment, which is coordination and continuity. Basically, our system is so frickin' fragmented that it's just hard for different parts of the system to coordinate care, and there's just a lot of inefficiency as a result. So here are the 4 levers that they identified in the study. Basically, create a system for national and regional capacity for monitoring and improving health system performance, outcomes, and affordability. Basically, it's like having a dashboard of outcomes and efficiency that everyone could look at that has comparable metrics across the whole nation and across regions. Right now, all that data is in all different places. Second lever that they identified in this category is basically ensure that all the people working in this area, including public health, including social systems, educational systems, like school districts, etc., and environmental like EPA, economic agencies, the Fed, they're all working together across agencies, both at the federal level and state levels, and even down to the community levels, to make sure that you're all working in the same direction of promoting community health. It might come as a shock to you, but like these agencies do not work together. Third lever in this category is interesting, public option. That's right, have a way for there to be just a baseline of services that anybody can access. So yeah, a public option. This might mean expanding the FQHC network, it might mean expanding public health, could be a variety of different options. The 9th lever, or the 4th lever in this category, is also an interesting one. It's basically decoupling insurance from the employer, or at least finding some way to eliminate the coverage disruptions that happen because health insurance is linked to an employer. So you lose your employer, you lose your health insurance, you lose your continuity. All right, last misalignment is the category of complexity. Our health system is ridiculously complex in addition to being fragmented. So 3 levers in this category. First lever is basically improve alignment among public financing programs, things like Medicaid, Medicare, to harmonize, simplify, strengthen accessibility, administration, and accountability. It's never made a whole lot of sense to me why Medicare and Medicaid are as different as they are. They're both federal programs. They are different in terms of the legislation that governs them, and that's why. And Medicaid is administered by the states. But does it have to be that way? Promote payment consistency. Theme here. Across care settings when services and outcomes are comparable. Right now, you can do a procedure in a hospital clinic and get paid more than you would if you do that same exact procedure and you're just in a primary care clinic in the community. That shouldn't be the case. Here's an interesting one for the conservatives. Deregulation. Deregulate. Streamline financing authorities, regulations, and oversight structures to reduce complexity and improve transparency. All right, so there you go. Health financing, coordination continuity, reduce complexity. Now in part 2, I'll tell you what's interesting about all this.